Hi, I'm Lauren Davis, and I'm your safety officer at Case Vet Hospital. And this video will show you the practices and procedures that will make your workplace a safe and worry-free environment.
The double doors at the entrance of the animal hospital provide safety for animals and their owners. For example, if a pet gets away, he or she will not get farther than the airlock without assistance. Note the fire extinguishers located throughout the facility. They are in clearly marked stations. The evacuation plan is posted on all fire extinguisher stations. Please read this carefully. When you hear the fire alarm, the fire department is automatically called by the alarm system. Drop what you are doing and proceed to the nearest exit immediately and meet the other employees in the front parking lot. Keep in mind the other employees working with you during your shift and alert the supervisors if any co-workers are missing. At the parking lot, employees will discuss the emergency and then plan the next steps. If the fire is small and contained enough to be extinguished by the fire extinguishers, some workers may decide to handle the fire while others evacuate animals in carriers. The fire doors between the rooms at Case Hospital are fireproof if left unopened and can contain the fires. Many of the fire doors have glass portals. This will allow you to see smoke or fire on the other side of the door without the need to open it. Exit signs are battery operated and will be visible even if power is interrupted. There are also battery-operated emergency floodlights, which will activate in case of power interruption or fire. For client and worker safety anywhere in the hospital, whenever you are mopping, make sure that you have designated your wet floor area with the wet floor sign. Avoid as much as possible mopping areas where clients are present. Maintain as much clearance as possible in the hallways by assuring that stacked boxes do not remain in the hallways for long. Use handrails on side of the hallways for support if a strong animal you are handling becomes too excited and tries to pull you down the ramp. The wide halls allow for motion of animals and workers in the hallways. When walking or transporting animals in the halls, keep in mind that they may interact with other animals in the halls and maintain as much distance as possible. Animal handling is covered in detail in a separate training video and session. The treatment area is also where our lab is located and where in-house medical treatments are performed. Animals being kept under observation are housed in this room as well. The sharps container is located here. Dispose of all broken glass and needles in the sharps containers. The special procedures room also houses the dental x-ray equipment. X-ray safety procedures should be observed. When performing dentals, wear goggles, a face mask, and surgical gloves to avoid bacterial contamination. Gases from the anesthesia machines are either absorbed by a scavenging system or discharged to the outside air. The anesthesia machine in the special procedures room uses a soda-sorb scavenging system. Excess gases are trapped in the soda-sorb filter element, which must be regularly changed. The gases for the anesthesia machines are under pressure and controlled by regulator valves. Although pressurized gas can be dangerous, the machine is safe if operated properly. Do not operate the anesthesia machine unless you are trained to do so. The boarding kennel, located closest to the front area of the building, can be the noisiest room in the hospital because of the animals and the ventilation systems. You should wear earplugs if you are working in the kennel for any extended period of time. When maintaining the kennel, assure that ventilation receptacles are cleared of animal hair and debris. The floors of the kennel are often wet and can be slippery. When working with animals that are outside of the cage, watch their body language and other signs of aggressive behavior. A separate video and session will specifically address animal handling. In the X-ray room, the lights are often dimmed or out to facilitate the viewing of X-rays. Please watch your step in this room. The X-ray machine is periodically checked and calibrated for proper operation and to minimize scatter radiation and unintentional exposure. When you are using the X-ray machine, wear the thyroid protection, lead apron, and gloves. You will be assigned an X-ray badge if you work with the X-ray machine regularly. This badge measures your cumulative exposure to X-rays and allows you to maintain a record of your cumulative exposure. The X-ray film processor is automated and will not expose you to chemicals. The helium tank in the X-ray room is used for blowing up balloons for children. All stored compressed gas tanks, including the oxygen tanks, are chained to the wall to keep them from falling over. The inside of the autoclave is pressurized and hot while it is functioning. The outside of the machine, however, remains safe to touch. Improper use of the autoclave can cause boilover, spillage of hot water, expulsion of steam and other materials, as well as being damaging to the surgical instruments. Details on autoclave safety and use are addressed in a separate training session. The anesthesia machine inside the operating room filters excess gases through a scavenging system, then vents to the outside of the facility. Case Hospital uses a laser for surgery. Do not look directly at the laser beam, as it can damage your eyes. Do not aim the laser at your skin or clothing, as it will burn flesh and other materials. Details on the use and safety of the laser are covered on a detailed training session. The pharmacy lab is where biological samples are prepared and examined. This area is also used for preparing prescriptions and viewing records. The sink in this area is also an eye wash station. Pull the knob on the spigot to activate the eye wash. Because biological samples are usually present at the counters in the lab, be sure to wash your hands with the antibacterial soap whenever you finish handling samples. The run suites are the dog kennels that are closest to the rear of the hospital. These suites provide more space for each animal. As with the other kennel, the floor will be often wet and can be slippery. Use the squeegee to remove as much of the standing water as possible. When maintaining the kennel, assure that ventilation receptacles are cleared of animal hair and debris. When working with animals that are outside of the cage, watch their body language and other signs of aggressive behavior. A separate video and session will specifically address animal handling. The grooming room is where animals are shaved and styled. When bathing pets, employees should wear rubber boots and gloves. In the bathing and grooming room, dryers are constantly running and animal hair is collected in the dryer filters. Assure that these filters are always clean, as too much accumulation can cause the machines to function improperly. Hair caught in the filter can also be a fire hazard. The floor will be often wet and can be slippery because of bathing. Keep the floors as dry as possible. All outlets in the bathing room are ground fault protected and will disconnect electricity if the equipment short circuits. Most outlets are also protected by covers. The sink outside the bathing and grooming areas can also be used as an eye wash station. Outside the grooming and bathing rooms are the supplies for bathing and grooming pets. Large primary containers are properly labeled for storage. In many cases, however, the primary containers are too large for normal use, and contents are often diluted and transferred to smaller secondary containers that are labeled here. Assure that the blank label is correct and corresponds to the fluid you transferred into the secondary container. The isolation room is used for isolating animals that are contagious. Contagious animals are typically not dangerous to humans. Often, this room is not needed and is used for overflow boarding Assure that the Overflow Use OK sign is on the door before using the room for boarding. This sign denotes that the room has been sterilized and properly cleaned. When an animal is in isolation, you must wear gloves and a gown before entering the room. There will also be a tub of chlorine bleach at the door for use as a disinfectant. The laundry room contains a washer and dryer as well as a storage closet for cleaning supplies. Take care to clean the lint tray in the dryer to avoid a fire hazard. Remove as much hair and animal waste material from the towels to be washed before using the washer. The cat boarding room houses cats. If you are pregnant, please let your supervisor know. Although the risk of toxoplasmosis is low, pregnant employees should avoid exposure to cat litter trays. One of the security and fire alarm system control pads is located near the double doors in the rear. Assure that all doors lock behind you for security reasons. The pharmaceutical safe is located just beyond the employee lounge area. Drugs are locked in the safe at night for additional security of controlled substances in case of a break-in. A shelf in the administrative area contains manuals for equipment operations as well as videos that detail various aspects of our operations, such as animal handling. The Osha station is located in the administrative area between the lab and the break room. Here you will find material safety data sheets on substances used at the hospital. You will also find other safety materials and manuals, as well as a bulletin board where workplace accidents are recorded. Most prevailing injuries in the hospital involve back problems, slipping on wet floors, and animal bites and scratches. If a coworker or client is injured, help them avoid further injury first, then assure that they are in a stable condition while you get help. When helping a client or coworker who is bleeding, wear gloves when possible to reduce the risk of infection. The OSHA protective equipment specifications posted here for the use of some chemicals are for exposure to the substances in an industrial manufacturing setting. In many cases, less protection is necessary when working with these substances in smaller quantities. Case Veterinary will provide you with the required safety equipment. You will also find a map of the entire facility here, with the locations of exits and fire extinguishers clearly marked. You will also find back braces and other safety equipment at the OSHA station below the mailboxes.
This completes the safety overview of Case Veterinary Hospital. Please feel free to ask your supervisor any questions or state concerns regarding the procedures. Remember, you have the right to know about substances, practices, and equipment in your workplace. Please do not hesitate to ask your supervisor if you have any questions.